Good morning. Thank you for joining us to Pause to Pray today. I've been asked to help us focus our time of prayer on healthcare, and I feel very privileged to have been able to recently go back onto the wards in preparation for going back to work after maternity leave, to actually get a bit more of an insight into what would be helpful to pray for. And the biggest thing, I think, is just morale at the minute. Morale is really low, staffing levels are really low, staff are stretched and therefore they're frustrated, they're disappointed that they can't provide the care that they hope to provide. There just aren't enough hours in a day, and there aren't enough people to help, and that's in adults, children's, that's even in GP surgeries, providing appointments, trying to see as many people as you can see. We're just really stretched, and that leaves us feeling really low. And I've been really struck recently by just how much we need God to break into the situation. I've been trying to be positive and chipper, if you will, with my colleagues, just in terms of, texting or being in the office for a little bit. And God is the answer. We really, really need God to just miraculously shift the atmosphere in these hospitals, on these wards, in these surgeries, in these offices where you've got community staff working, clinics. Healthcare happens in so many settings, and I only have personal experience with the wards, but I know from chatting to people at church, from chatting to friends, that morale is low in lots of those areas. Could we just pray that that the Holy Spirit would just break out into those areas, that there would be a miraculous shift in how people are feeling, how people are acting, talking to each other, how people are, able to just, how people are being. The Holy Spirit is the one that will change that, and we just need to pray for that so regularly, because it feels impossible. But I know we've got a God of the impossible. And so, morale in healthcare would be really helpful to pray for at the minute. I also really feel like praying for our government is something that would be really helpful. We are incredibly blessed, very privileged to have access to free healthcare, particularly when we know just how many members of our communities who are on the poverty line or below the poverty line are needing that sort of thing. If they had to pay for healthcare, it would just be dire. And so we're very blessed, and I don't know what the future looks like for our NHS. I don't know what the future looks like for free healthcare. And I think we should pray for the people making those decisions, for our governments, for our councils, for our hospital trusts, where money comes from, how it's spent, staff that we're hiring, the cost of things. There's a lot of decisions that are being made and a lot of thoughts that are happening, and I think just praying for our government, that God would give wisdom and compassion in those decisions as well. So if we could just lift our government up with the decisions they're making about healthcare specifically in mind. I also think it would be really beneficial to pray for our communities, because they're the ones that are accessing healthcare, making GP appointments, having routine clinic appointments, needing emergency care in A&Es, being admitted to wards, having phone consultations with members of healthcare in the community. That there would be a sense of appreciation, reassurance and patience, I think. My colleagues have shared with me that they are bearing the brunt of a lot of frustration from patients and parents and families, And I imagine that is, you know, citywide, nationwide, with regards to accessing the NHS. Not everybody, of course, but people are scared when they're unwell. People are scared when their families are unwell. And when we're scared, we can be a bit short, a bit impolite, frustrated, angry, and praying for those people. I think that there would be a real sense of peace for them. Yeah.